If you've ever felt like food gets stuck whenever you eat, this procedure will fix the problem for you. In this video, we're performing what's called an upper endoscopy to see exactly why someone has trouble swallowing. In this video, you can see what's called a narrowing or stricture, which is a fibrosis or scarring in that esophagus that prevents food and water from going down. When we do this, we actually position what's called a balloon in the narrowed area. We open up that balloon, break open the scar tissue or the fibrosis, and allow someone to swallow again. And while we're down there, our job is to find out why. Why are things getting stuck? Why do you have a narrowing? Why do you have a stenosis? So we can get down to the root cause of what is going on. The goal is to create more space, at least have a normal esophagus, so you can swallow and drink whatever you want. So instead of your esophagus being this small, it gets to be a normal size right there. This is a common procedure that provides immediate relief for their symptoms. Hi, y'all, Dr. Islam here, aka your poop guru and esophageal expert. I have treated thousands of patients with trouble swallowing with this procedure, and it works effectively to allow patients and individuals to swallow food better, water better, and to not allow things to get stuck anymore. Today, we're talking about esophageal dilation and why patients need it, and what causes the esophagus to narrow in the first place. If you ever feel like food gets stuck or water gets stuck, or you're choking when things are going down, this video is for you. So esophageal dilation is basically a mechanism for us to break open the scar tissue that forms in the esophagus to cause that esophagus to become narrowed and smaller. As your esophagus gets smaller or more fibrotic, it makes it more difficult for food and water to go down. And so we have to find a way to break that fibrosis. And one way to do that is to use a dilation to actually break up that scar tissue in that esophagus, open up that esophagus to allow things to pass through a lot easier. So if you're wondering, hey, do I have a stricture or not? Common symptoms include food or water getting stuck, choking whenever you eat or drink, feeling like you have a lump in your throat in this area right here, chronic acid reflux that doesn't go away, needing to cut up your food in smaller pieces, having to cut up your pills because they get stuck if you take them. These symptoms are not normal. They should not be ignored. I cannot tell you the number of people who tell me or think this is normal. It's not at all. So what causes the esophagus to narrow? The most common cause is acid. By far, it's the most common cause. When pathological acid goes up into the esophagus, your esophagus does not like that acid always being up there. So it forms scar tissue and inflammation to prevent the damage from occurring. And sometimes that inflammation will cause a fibrosis to occur. So even if you don't have typical acid reflux, you may have silent reflux that can do that. Other causes include an allergic condition called eosinophilic esophagitis, but the most concerning thing that I worry about is cancer. If there is an obstruction in that esophagus or a mass that's growing, that's going to cause that sensation of food and water getting stuck as it's going down. So our job is to find out not only can we fix the problem, but to find out why. What is the root cause? Because once we find out the root cause, then we can find out what we can do to make sure it doesn't come back. So the procedure is performed during an upper endoscopy or an EGD where we put you to sleep. I use a small camera to take a look inside the esophagus, stomach, and the small intestine. Our job with this upper scope or an EGD is to answer the question why. Why is food and water getting stuck? Is there a narrowing? Is there a stricture? Is there a mass that's there? If I see a stricture or scar tissue, I will slowly insert a balloon down that EGD scope, open up that balloon enough where I can break open that stricture, leave it there for a little bit, and then close off that balloon and pull the scope out. The procedure itself takes a total of maybe 5 to 10 minutes, and we can fix the problem right then and there. So what happens after dilation? Most people notice an improvement immediately. Yes, they're so thankful they can go out and eat, drink some water, and not be worried about them getting choked or having something stuck while they're eating and having that in a public place. Food passes easier, meals become a lot more enjoyable, they can start to have their pills. It's just an overall better quality of life. Now, depending on the cause or the intensity of the stricture, some people may need repeated dilations to open up that esophagus more. And that is why understanding and treating the important cause is so important. So when should you see a GI doctor? Straight up, if anything gets stuck, see me. Guys, that's not normal. Food should not get stuck as it's going down. Pills should not be stuck as it's going down. Water should not choke. If anything is choking or things are getting stuck, come see me. The quicker we can identify the problem, the quicker we can fix it, and the easier it is to fix as well. So if you're struggling with food getting stuck, chronic acid reflux, heartburn, regurgitation, anything going on up here, don't suffer from this. Come see us. We can find out the root cause of what is going on, then offer you a treatment plan to get you feeling better. Visit our practice, lubbockgastro.com, for more information. Call our office. We can see you today. You don't need a referral. And if you want to learn more about swallowing difficulties, click on this video right here about acid reflux and esophageal strictures.